My work requires I do a lot of travel. I'm at airports sometimes 4 or 5 times a month, and walking, I always seem to get the longest terminal. And by the time I get home at night, I couldn't move. And the doctor could clearly show the bulging discs that was causing some serious discomfort. It became a real problem going through security. I used to have to take off my shoes and carry this device to pick the shoe up and put it on the security belt. When I get to the other side, I have to take it down, and it got to be almost a joke for people I was traveling with. I had to stop flying. I had to be very careful at meetings. When I was on that hydrocodone, I decided I had to have some type of repair. I ended up getting 3 different opinions. I was hoping to get something different, and that's what I was able to get up at Maine Medical. And we were just so impressed with what Dr. Desai's operation was like.
Just have a seat.
Thank you.
Most of my folks describe the pain of nerve compression as the worst pain they've ever felt in their life. The reality is that much of what we do is education and then helping people find some of their own solutions more holistically around wellness, small things that might be adjustments in their lifestyle that can make a dramatic difference in how they feel. In other instances, we use surgery in these kinds of conditions, take pressure off of nerves or the spinal cord where it's critical. When that goes away, it's wonderful. It's really what makes the job great and fun when you have somebody come back and they wake up and it's all better after they've been through a nightmare.
He didn't rush us. He spent an inordinate amount of time explaining what the outcome could be, what I could expect. I spent some time talking to him about what my needs were.
He runs a pace that, would put a 20-year-old to shame.
I wanted to be done early in the morning, and if it was at all possible, I wanted to be home that night. I thought that was wonderful. And a hospital the size of Maine Medical Center was going to accommodate me. When I woke up from the anesthesia, Dr. Desai came in and said, everything went exactly the way we planned. He says, what do you want to do? I said, I want to go home. And I went home.
Part of what I think appeals to many of my partners is not just that we have the highest level of technical skills and tools to fix a problem, but also that we can look at that whole patient and try to get them well in general, in a bigger way.
So one of the key things I think in any successful practice when you're to provide good high quality patient care is the collaboration. We work very closely to do the best for the patient because that's what it really is all about.
After the surgery, I can just bend right down and pick it up. So the surgery has just really improved the quality of my life.
When you walk into the room on somebody that you've done surgery on, without having said a word, you look at the expression on their face and you see the burden off, and you already know the answers to how they're doing.
The surgery went perfect. I have felt significantly better. I'm able to climb stairs, walk airports. Now it's not a problem at all.
His outlook was better. He was more positive in the way he proceeded through the day. And it just changed his whole personality back to my old Charlie.
I am very, very pleased. If I'm going to be having this procedure done, it's going to be done my way. And I've just found that just to be right exactly what I want at Maine Medical.